What's good, YouTube? It's Jay, and I'm gonna get back again with another video. Well, it's Saturday morning where I am, and I want to share a little something with you guys today. One of my subscribers asked me where I was from, and I just can imagine that because of the accent, and sometimes I have to speak slower because I'm from the deep south. However, we are back again on a Saturday morning with another video for you in order that you may pass the TMC exam on your very next attempt. Today, we're talking about Myasthenia Gravis. We've covered a lesson on Guillain-Barré, but this is our subject for the TMC exam today. And you will see these, or one of the two, on the TMC exam. And without any further ado, let's do this. Okay, guys, again, I'm working from the left to the right on the board, and our discussion is Myasimic Gravis. This is a descending paralysis disease, which simply means that the disease moves from the mind to the ground. It has a gradual onset of weakness, and this weakness improves with rest. And you gotta pick up little keywords on the exam to let you know or to help you to determine which neuromuscular disease that you are dealing with, all right? In this disease, you will find ptosis, which is drooping of the patient eyelids. Double vision, diplopia is another thing that you will look for. Difficulty swallowing. And remember, this disease moves from the mind to the ground, or from the top to the bottom. So difficulty in swallowing is a big part of diagnosing this neuromuscular disease. The patient will also have shallow breathing. Breath sounds will be diminished. Now, in order to diagnose Myasthenia Gravis, and these people will present themselves to the emergency room time and time again, and you will see them, okay? But in order to diagnose them, we have to do what is called an Phonium test or tensilon channel test. Phonium is a medication that is given, and we'll talk about that just a little bit later. Another test that used to diagnose Myasthenia Gravis is electromyopathy, or in short, we call it EMG, and you will see that on the TMC exam in both the clinical sim exam. We also test them for antibodies, and we do a test called an ice pack test. This is probably the most important, one of the most important things you will see on the exam when it comes to these neuromuscular diseases, because in the question, they would actually say that they applied an ice pack to the patient eyelids, and the patient got better. They felt better. If an ice pack test is positive and to make the patient feel better, then that is definitely Myasthenia Gravis, without a doubt. It is the test, and you have found out your problem. They come into the ER. Your patient comes into the ER complaining of weakness over the period of time, and it improved with rest. They got drooping eyelids and double vision, and then you do the ice pack test. It's positive. It usually is a sign that they have this neuromuscular disease. Now, whenever there is a problem with the upper airway, we have to monitor the ventilatory parameters. We must monitor them closely, and you must monitor them closely on the exam. You monitor the tidal volume, the vital capacity, and the MIP. And we'll get to those on the top of the board on number 2. But there you have it as far as what this disease is, how it will present itself, and how or what you can do to diagnose them. And for the exam, these people usually show up in the emergency room, so be aware of that. Now, what is ventilatory failure? Ventilatory failure is whenever you have a PaCO2 greater than 45. That's the cutoff. Not 46, not 47. PaCO2 greater than 45 is ventilatory failure. The ABG will show hypoxemia. The pulmonary function test will show decreased forced vital capacity, decreased tidal volume. So in these neuromuscular disease, you will see decreased volume for sure. For the exam, you will have to answer a question pertaining to tensilon. Why do we use tensilon? We use it to diagnose myasthenia gravis, not to treat it. We diagnose MG and not treat it. That's why tensilon is used. If the tidal volume, vital capacity, or MIP worsens, you administer tensilon to your patient, and if the ventilatory parameter worsens, this is called a cholinergic crisis, in which actually the patient has had an overdose. But need not to fear, because in this case, we give them atropine, because atropine will reverse the symptom of a cholinergic crisis. Now, for maintenance of treatment to help patients with myasthenia gravis, we give them what is called mestadone or neostigmine. These drugs would help manage their disease process, and we'll talk about that more in a minute. Also, for the treatment of myasthenia gravis, these patients must be treated in the ICU. You cannot treat them on the floor or leave them in the ER. They must be transferred to the ICU, and you will see that again. Now, in the ICU, we know that we closely monitor everyone, but when we get them to the unit, we want to closely monitor, again, the tidal volume, vital capacity, and the MIP. As much as I said that, you should be wrapping your hands around that. Closely monitor the tidal volume, vital capacity, MIP. Now, usually because this neuromuscular disease starts from the mind to the ground or from the head and downward, most of the time we have to intubate these patients. So be always on stand guard to intubate, but don't intubate them too fast. Check out the ventilatory parameters. If they are decreasing, then don't wait until they fail. Go ahead on and intubate them. We give them a lot of bed rest and a soft diet, oxygen therapy to treat the hypoxemia, hyperinflation therapies such as IPPB, if they're on the ventilator, pulmonary hygiene. You know, when someone got a tube down your throat and machine is pumping and you're not able to do for yourself, pulmonary hygiene is very important, not only to the patient, but for the care of these patients. And if you do a good job in treating these patients, I can assure you they will highly appreciate it, and you will come through very well on the exam. Everything on this board you will see in some form, in some type of question on the TMC exam. Now, remember the maintenance drugs as well as cholinergic crisis. All of these things are treated by giving the patient atropine. Atropine will reverse the process of the crisis and all of the medication that you will give for myasthenia gravis. Okay, there you have it, people. Roman number 1, 2, and 3. Myasthenia gravis is a descending paralysis disease. It moves from the mind to the ground. You will see drooping eyelid, double vision, difficulty in swallowing. The patient will have decreased or diminished breath sound. Remember that we diagnose them with Phonium, or we do a tensilon challenge test. The MEG or electromyography is a good test to use for patients with myasthenia gravis. And we also test for antibiotic. The ice pack test is highly recommended and highly used to diagnose neuromuscular diseases in these patients on the TMC exam. The ABG will show hypoxemia. Pulmonary function testing will show decreased forced vital capacity and decreased tidal volume. We must protect the ventilation status of these patients, okay? We do not use tensiloquine to treat these patients. We only use tensiloquine to diagnose myasthenia gravis and these neuromuscular diseases. And there you have it. Okay, guys, I'm back, and I certainly like to thank you for tuning into my channel. Now, Myasimic Gravis and Guillain-Barré, and there's another disease that we haven't talked about, ALS, which is very common, that may pop up on the exam every now and then. So I like to encourage you to look up and study the causes and the treatment for ALS. All right. Thank you again for watching. Hey, do me a favor. I would like to earn your subscription to my channel. However, hit that like button, subscribe to my channel, turn on the notification bell, because I'm posting videos every week concerning content that you will need for the TMC exam and that you pass it on your very next attempt. And until next time, we out.